The Spinal unit at BMI the Clementine Churchill Hospital offers fast, accurate diagnosis and access to advice and treatment for general back and neck pain through to complex spinal deformities. Our expert consultants, state-of-the-art technology and treatment methods attract referrals from across the world.
My name is Sean Malloy. I'm a consultant spinal surgeon both here and at the Royal National Orthopaedic Hospital in Spinal. My training is in the more complex cases, so particularly in spinal deformity, both of the paediatric patients and the adult population. We're very lucky here at the Clementine as we've set up a spinal ward for patients, so we've had a dedicated spinal nursing team now for some years, and of course training has gone with that, and the expertise that they've actually developed over the years has been second to none really. Patients get referred in a number of different ways, either from the GPs in the local area here or from orthopaedic or spinal consultants from around the country. We also have quite a large number of patients who come from abroad for their specialist treatment because of the expertise that we have here. And when they come, they get clinically assessed by myself and a physiotherapist. They then get referred on for specialist imaging, which we can do here at the Clementine Churchill Hospital. We have very good backup services for patients who don't need an operation and can be treated conservatively. We have a good pain management scheme for patients who actually can be dealt with in that way. But if they're going to be operated on, then they feed into a different pathway, which means that they will see a pre-assessment nurse and get a full gamut of tests to make sure that they are actually physically well enough for the surgery. And they will meet with all of the members of the multidisciplinary team, so the physiotherapists, the nurses on the ward. They'll see the intensive care of the high dependency unit if that's actually applicable to them. I like the patients to be informed of exactly what type of surgery they're going to have done and how their patient journey is going to look and how long they're going to stay in hospital, and then when they leave hospital, what is their point of contact. So we have a spinal care nurse who looks after a lot of the needs of the patients whilst they're in their preoperative phase, in their perioperative phase whilst in hospital, and then post-operatively. Whilst in hospital, both myself and the spinal care nurse will see the patients every day and assess their progress and make sure that we feed back in a multidisciplinary way to whichever specialities are needed.
The Spinal unit at BMI the Clementine Churchill Hospital houses London's only O-arm surgical imaging system, which provides surgeons with real-time intraoperative imaging capabilities.
Because of the O-arm navigation system here, we've been able to take on very complex cases. It enables us to be able to look around the corner essentially when we're operating, so whatever structure you're operating on, we can effectively in a 3D model, in a virtual model, see what's actually coming around the corner and therefore stop ourselves from making any mistakes that might happen with conventional surgery. The way it works is that once the scan has been performed, then every instrument that you actually take up and utilize on that patient is tracked by the camera and will tell you where you are in space at any one time. So you can navigate your way around the spinal cord, keeping the patient safe all the way through the surgery. We've also been very lucky over the years that we've been given the facilities here to train, educate the staff, and to build a team that have been able to take on the most complex cases. As a result of that, the outcomes from surgery I have noticed have been fantastic.
When I came into the Clementine Churchill for my spinal surgery, I felt that the staff that were around me, and I'm including from the surgeons down to basically the cleaners, they were just so friendly and helpful. And when you're in an enormous amount of pain, they understood. They knew how to move you, how to get you out of bed. The physios, the experience and the knowledge that they carried reassured me that I was in the best place with the best people. But the staff all have a role to play and they all assisted in making my stay as comfortable as possible.
We have over the years been able to maintain very, very good staff with excellent expertise, and I think that really makes a huge difference. If you're going to take on this complexity of stuff, you need to have everything going in your favour. Not only imaging, but you need the clinical expertise both in the ward and also in theatre to be able to affect change for these patients. And we really feel that we do make a significant difference to these patients.
If you have back or neck pain or any concerns relating to your spine and would like to book an appointment with a spinal surgeon, please call us on 0208 872 3872.